This section is on dietary concerns. Now, you'll note that in various sections there are some discussion of dietary issues. For instance, low salt, low fat diets are discussed in the cardiovascular section. Diabetic diet is discussed in the endocrine section under diabetes. But there are some dietary concerns that I wanted us to look at. And the first of these has to do with consistency modifications. So let's look at a clear liquid diet. A clear liquid diet is exactly what it says. It is liquids that are clear, or it's sometimes called a see-through diet. It's liquids without any pulp in it, no milk in it. So black tea, broth, cranberry juice, apple juice, things like flavored gelatin. Now, flavored gelatin is what you and I would call Jell-O, but on NCLEX it's going to be called flavored gelatin. Popsicles, ginger ale. These are all clear drinks that are included on a clear liquid diet. Clear liquid diet might be given after surgery till we see how the patient is tolerating liquids. It can also be used in patients who've had nausea, vomiting, for instance. A full liquid diet is everything that was on the clear liquid, plus now we can add milk and milk products, so that means I can get ice cream. We can also add fruit juices. So you can have orange juice that has a pulp in it, and that's appropriate on a full liquid diet. Cooked cereal. So a cream of wheat would be allowed on a full liquid diet. Now, usually the diet then progresses from a full liquid. It may progress to a soft diet. A soft diet is everything that was on the full liquid diet, plus now the patient can have really soft foods, so pureed foods. They can have applesauce. They can have other kinds of cooked fruit. So maybe canned peaches, that's been cooked. Very tender meat, mashed potatoes, but not French fries. We don't want things with a lot of grease in them. So they could have a poached egg, but not a fried egg. Poached eggs are thought to be easier to digest than the fried egg would be. And a bland diet is usually considered to be a soft diet without spices. So this is everything on that soft diet but avoiding the spices. So if you had a patient who was on a bland diet, all of the following are on their tray. Which would you remove? So on the tray of this patient, there is a package of salt, a package of pepper, a package of sugar, and a little container of milk for their beverage. So what would be allowed? What must you remove? The salt, the sugar, the pepper, or the milk? What you would remove would be the pepper. Salt would not be considered to be a spice, but pepper would. Now let's do a question. A clear liquid diet is ordered for a client. All of the following are on the tray. Which should the nurse remove? Flavored gelatin, ice cream, beef broth, or ginger ale? And the best answer is answer number 2. Ice cream is not a clear liquid. That would be allowed on a full liquid diet, but not a clear liquid diet. All right, are we ready for another question? Which client is most likely to have a clear liquid diet ordered? 1, an adult who had abdominal surgery yesterday. 2, an adult who had an open reduction of a fractured tibia yesterday. 3, a 4-year-old who is in sickle cell crisis. Or 4, a 6-year-old who has pneumonia. And the best answer to this question is answer number 1. Most patients with abdominal surgery will need to start on a clear liquid diet and progress because peristalsis has stopped during their surgery. Answer number 2, the patient is probably not had loss of peristalsis, so after a few sips of clear liquids, they'll move right on up, so they don't need to be on a prolonged clear liquid diet. Number 3 and 4, both of these patients, the sickle cell and pneumonia patient, need fluids, but they don't have to be clear liquids. Another aspect of nutrition that I wanted us to talk about now, I want us to think about enteral and parenteral nutrition. When we think about enteral nutrition, this refers to the fact that the intestines, enteral tells us that the intestines are absorbing the food so that the nutrients are absorbed in the intestinal pathway. Now, most of us have oral enteral nutrition several times a day. We eat lunch, we eat our meals, and that, of course, is the preferred method. Some patients, there's nothing wrong with their GI tract, but they may not be able to swallow or chew or be alert enough to do so, so they might have tube feedings. Now, if there's a tube feeding in the short term, we can use an NG tube, a nasogastric tube. If this is to be a longer term thing, they may use a gastrostomy tube or an enterostomy tube, like a J tube, a jejunostomy tube. Now, tube feedings can be given either intermittently, usually QID, or continuously on a pump. Now, the intermittent more closely mimics the way people normally take in their nutrition. However, sometimes it's ordered continuously on a pump. It would be important, if your patient is getting any type of tube feeding, to check the tube placement. If this is a NG tube, for instance, the best way to assess the tube placement is going to be to aspirate the contents and check the pH. It ought to be less than 4. Now, I know there's some other methods that you may have learned that can help you, such as injecting air and then listening with a stethoscope as you inject that air, and you'll hear a thump or a swooshy kind of sound. This simply tells you that there's air in the GI tract, but it doesn't tell you whether the tube is up at the base of the esophagus or down near the bottom of the stomach. It would be important that the tube be closer to the bottom of the stomach for the tube feeding. If it's right up close to the esophagus, that would increase the risk of aspiration. The patient's head, the head of the bed, should be elevated. I want also to look at the concept of total parenteral nutrition. Parenteral means that the nutrients are absorbed outside of the normal intestinal pathway. So total parenteral nutrition is infusion of nutrients through a central venous catheter. There are lots of patients that need this. Sometimes these are patients that have intestinal illnesses like cancers. It could also be patients that sometimes we use TPN for severely burned patients, for instance, that have incredible amounts of caloric needs. But so a central catheter is used. This is a hypertonic solution that's infused. The definition says it's going to be greater than 10%, but usually is closer to 25-30% glucose. Amino acids are in there, which are the building blocks of proteins, along with water, vitamins, minerals, and frequently lipids are in the TPN solution. Now, when this solution is going in, it's very, very hypertonic. So it's going to be very essential to monitor the flow rate very carefully. If it goes in too rapidly, this could put the patient in overload. We also need to do glucose checks. I put the word AccuChecks on the slide for you, but these are glucose checks. There is a tendency, this is high glucose and it's going directly into the vein. And sometimes the pancreas has a hard time keeping up with insulin production. So we need to monitor whether the patient is hyper glucose or sometimes even have a low blood sugar. Since this is a central venous catheter and the end of that catheter is literally in the heart, then infection is a major concern. So this is going to be a sterile dressing. If any infection gets in there, any organisms get in there, you can have septicemia extremely quickly. So this is going to be a sterile dressing. You don't give anything else in the feeding line. And we might have a multi-lumen catheter so that you had one lumen for feeding and one lumen for meds and one lumen for drawing bloods. That's fine, but you do not draw bloods or give meds through the feeding line.